Good day, everyone. We are the Group 16 and we are going to explain the Transcultural Care Theory or the Cultural Care Theory of Madeleine Leininger. So I am Mary Catherine Astabuboy and I am with my groupmates.
So first we will discuss about Madeleine Leininger's biography. So this is Madeleine Leininger. Madeleine Leininger was born on July 13, 1925 and died on August 10, 2012. She was a nursing diploma at St. Anthony's Hospital School of Nursing, undergraduate degrees at Mount St. Scholastica College and Creighton University. She also opened a psychiatric nursing service and educational program at Creighton University in Omaha, Nebraska. She was a Master of Science in Nursing from Catholic University of America in 1954. She had a doctoral program in cultural and social anthropology at the University of Washington in Seattle and became the first professional nurse to earn PhD in anthropology. So these are the achievements of Madeleine Leininger.
The Transcultural Nursing Theory or Culture Care Theory by Madeleine Leininger. Transcultural nursing, according to Madeleine Leininger, is a significant field of research and practice that focuses on the comparative cultural ideals of care, as well as the beliefs and behaviors of people or groups from similar or distinct cultures. It is the study of cultures to better evaluate patients' groups' similarities and differences. To deliver meaningful and effective nursing care services to people's cultural values and health illness setting, it is necessary to focus on the fact that different cultures have different caring behaviors and different health and illness values, beliefs, and patterns of behavior. In 1995, she defined transcultural nursing as a substantive area of study and practice focused on comparative cultural care values, beliefs, and practices of individuals or groups that is similar or different cultures to provide culture-specific and universal nursing care that practices in promoting health or well-being or to help people to face unfavorable human conditions, illness, or death in culturally meaningful ways. Now, we are in the Leininger Sunrise Model. It describes the link between anthropology and nursing ideas and concepts, and so defines the framework of cultural care theory. When nurses do cultural assessments of patients, they follow this model. The Sunrise Model. The cultural care worldview, it flows into knowledge about individuals, families, groups in diverse healthcare systems. This knowledge provides cultural specific meanings concerning care and health. The next focus is on the generic or folk system, professional care system, and nursing care. Information about these systems includes the characteristics and the specific care features of each. This information allows the identification of similarities and differences or cultural care universality and culture care diversity. Next are nursing care decisions and actions, which is involved in cultural care preservation or maintenance, culture care accommodation or negotiation, and culture care repattering. It is here that nursing care is delivered.
A meta-paradigm is a set of theories or ideas that provide structure for how a discipline should function. The four meta-paradigms of nursing include person, environment, health, and nursing. Human beings believed to be caring and capable of being concerned about others' needs, well-being, and survival. It is natural to us to care for oneself as well as others. Sometimes we look to and care about other people because we are compassionate beings. It is simple for us to cope and care for others. Environment. Worldview, how people look at the world or the universe and form a picture or value stance about the world and their lives. So the culture affects our environment, the society, those happenings in the patient's surroundings. And of course, it is included the events, situation, and experiences of a certain person. So Madeleine Leininger view environment depends on its culture. Health, a state of well-being that is culturally defined, valued, and practiced. It reflects individuals' ability to perform their daily role activities in culturally expressed, beneficial, and satisfying healthcare or well-being services. So they said that health is universal, but it also has differences. Madeleine defined health based on the individual's culture in a way that represents the belief, the value, and practices of a party culture. She also said that health is universal and distinct. Universal is a common definition of health. It is our common views in health, but there are distinctions. We have different views individually or culturally. Nursing, a learned humanistic and scientific profession and discipline which is focused on human care, phenomena, and activities to assist, support, facilitate, or enable individuals or groups to maintain or regain their well-being in culturally meaningful and beneficial ways, or to help people face handicaps or death. She said that nurses must be sensitive to beliefs, values, and practices of each other. So she gave the 3 modes of nursing, or the 3 types of nursing action that are culturally based and thus consistent with needs and values of the client. This is the Madeleine Leininger meta-paradigm. Her views on persons, environments, health, and nursing.
So this is our case scenario based on Madeleine Leininger's transcultural theory or culture care theory. Julia, a 17-year-old female client with a history of smoking 1 pack a day for a year, is currently suffering from a recurrent cancer of the bone. She has been hospitalized with fever and neutropenia. These are the common complications of her recent chemotherapy. So Julia lives with her parents and her parental grandmother. Her parents and grandmother were born in the Philippines and migrated to the United States. Julia's grandmother is a devout Christian, whereas Julia is a firm believer in Jehovah's Witnesses. Her grandmother always has faith in everything, whereas Julia has become inactive with her religion beliefs because she knows that her time is finally near.
Good morning po, ma'am. Ako po si Nurse Pia. Ako po ang nurse niya ngayon. Kumusta po kayo? Medyo ayos na ng nurse. Good morning po, ma'am. Nandito na po yung lab result niyo at based po sa result ay kailangan niyo po ng blood transfusion.
Po, hindi po pwede against po yan sa religion namin. Tinawas po kasi ako.
Kung hindi niyo po kasi magtutuloy yung blood transfusion, baka lalala pa po yung sitwasyon niyo.
Nurse, kahit anong mangyari, ayoko talaga.
Sige po. Babalik na lang po ako mamaya. Ma'am, nandito na po yung waiver ko para pirmahan niyo po kasi hindi po kayo pumayag. Naka-indicate din po dito yung mga posibleng mangyari po sa inyo kapag hindi po tinuloy ang blood transfusion.
Akin na, nurse.
Sorry po, ma'am. For guardianship. Salamat po, ma'am.
Julia was first diagnosed, she was told that her type of cancer was malignant and had already spread from his primary site in her pelvis or in the hip bone to her lungs. Her treatment was consistent of surgery, a year of chemotherapy, and 6 weeks of radiation. During the past year, whenever Julia asked if the cancer could kill her, the team members respond with reassurance, saying that there are patients that who did not survive, but rest assured that we will do our very best to help you get over this disease.
Good morning po, ma'am. Ito na po yung gamot niyo.
Mas malala po ba ang sakit ko?
May mga pasyente po na hindi po nakayanan ng kanilang sakit. Pero huwag po kayo mag-alala, gagawin po namin ang aming makakaya upang pagalingan kayo.
Salamat po.
Julia hasn't forgotten a word. Just 3 months earlier, her routine surveillance scans were normal. Now, a chest x-ray reveals a large lesion or abnormal cells in her right lung and large tumor on her pelvis. For that reason, Julia asked if her mother can stay overnight in the hospital with her. On the past admission, she has preferred to spend time alone or with her friends. Julia also tells the healthcare team that she wants to hear her scan results and treatment options at the same time with her parents. Her parents would prefer to keep all bad news as a secret, but they agreed to grant her wishes. However, this decision deeply upset Julia's grandmother. On their next visit, Julia said, "Why does grandmother always pray the rosary over me? Doesn't she know it doesn't work?" In the health team meeting, a new Filipino registered nurse, Pia, expressed her understanding and empathy with the grandmother's constant interference, knowing that her grandmother argues with the parents' decision to share information with Julia. The nurse, who also came from a religious family, says that there is nothing wrong about praying the rosary over her because her mother also does that when she gets sick.
Nurse Adelaide, bakit laging nagdadasal si Lola? Alam niya bang hindi niya ipinipigil?
Ma'am, wala naman po masama kapag pinagdadasal ako at pinagawa sa'yo. Kasi ganyan din po kasi ang nanay ko kapag may nararanasan po ako at inik ng sakit.
Pia is a transcultural nurse who has been assigned to provide culture-specific care for Julia. On her visit, she gathered important information regarding Julia's situation. She had learned that before Julia became really sick, she had been under pressure against her parents' authority and questioned her faith. She stopped attending Mass at age of 14, and after she became ill, she still refused to participate in formal religious practice. Her parents and her grandmother have always looked to their priests and to Catholic practices and rituals such as anointing sick, praying the rosary, attending Mass, and praying novenas for support and hope. During a discussion with her family members about spiritually, Julia stated that one of the ways the team could help her would be by taking care of her grandmother. To Julia, she seemed very anxious all the time. She said she thought it has something to do with church, because she tried to get her to pray the rosary and meet with a priest. Julia said she couldn't talk to her grandmother about how disappointed this had made her. Tia met with Julia's grandmother and determined that her anxiety was related to religion. She'd been praying for a miracle to happen, but it wouldn't happen unless Julia developed stronger faith. She feared that Julia died without going back to church. She wouldn't go to heaven. At her request, the spiritual care counselor met with her weekly to read the Bible and pray. The goal was to help her to see that although Julia's relationship with God was different from her own, it was important to her as it was to her grandmother. After one visit, she commented that, "My God will not allow my granddaughter to suffer. I believe that my granddaughter has a spot in heaven."
Nagkausap po kami ni Julia kanina at may nabanggit po siya sa akin na may paniniwala pa rin po siya sa Diyos. Pero hindi niya lang po ito pinapakita.
Naniniwala akong hindi paparusahan ng Diyos ang aking apo. Naniniwala akong mapupunta siya sa langit.
Huwag po kayong mag-alala, gagawin po natin ang lahat.
Salamat.
Julia explained that even though she didn't go to church, she still believed in God. And her grandmother said she felt better knowing this. With the help of Nurse Pia, the family priest, Julia, and her grandmother were able to explore their individual spiritual beliefs and needs to gain respect for their differences. Julia remained firm in her refusal to participate formally in Catholicism, but she explained to her family that she believes in God. She was willing to let her grandmother pray for her in his presence, acknowledging that this was helpful to her grandmother as long as her grandmother does not talk about religion all the time. As her death becomes near, Julia told her grandmother that she was seeing a soul of her deceased grandparents on her dream on a regular basis and found this very comforting. She said they were waiting for her and told her that heaven was a safe and wonderful place. Julia's sharing of her spiritual experiences brought a great comfort to her family. She became more accepting of her grandmother praying in her room and the priest's frequent visit. She agreed to allow her family to plan a Catholic wake and funeral mass for her. And the family priests were at her bedside and had just finished praying the rosary together when she passed away. Nursing process functions as a system guide to client-centered care with 5 sequential steps. These are the assessment, diagnosis, planning, implementation, and the evaluation. So the first process is called assessment. So assessment, it is where the nurse assess their patients to gather clues, make generalization, and diagnose human response to health conditions and life process. It is the process where nurse talks or communicate to their patients to assess their patients or to collect or gather some data. So collecting data means taking the patient's vital signs, knowing the patient history, or simply asking the patient's lifestyle and performing a nursing assessment. It is where you use your critical thinking to get an idea what might actually be going on with your patient. So as you can see here in our case scenario, Nurse Pia communicate with her patient to gather or to collect some data so that Nurse Pia will know the patient's diagnosis and the care that the patient should receive. And that is how nursing assessment works. Next is nursing diagnosis. The diagnosing phase involves a nurse making an educated judgment about a potential or the actual health problem with a patient. So first and foremost, nursing diagnosis is not a medical diagnosis. Nursing diagnosis, it is the patient response. Yes, it is the response of the patient to what is happening. So I'll give you an example that nursing diagnosis is not a medical diagnosis, such as asthma. But if your patient with asthma is really restless, anxious, or nervous, the nursing diagnosis could be something like anxiety because it is the patient response to their asthma. So as you can see here again in our case scenario, Nurse Pia noticed how anxious Julia's grandmother, worrying that Julia will not go back to church. And as Nurse Pia met with Julia's grandmother, she determined that her anxiety was something related to religion because that is the response of Julia's grandmother to that situation. And that is the example of a nursing diagnosis. So the next stage is planning. It is the stage where goals and outcomes are formulated that directly impact patient care based on EDP guidelines. So in planning stage, it is like figuring out a game plan on how your patient is going to achieve their goals. It is like planning out exactly what will you do as a nurse to help your patient reach their goals. So as you can see here in our case scenario, Nurse Pia planned on what she will do to help her patient reach their goals. So next is the implementation stage. It is the steps which involves action or doing the actual carrying out of interventions outlined in the plan of care. So it is exactly doing your planned interventions that you planned in the previous stuff. So you already assess your patient. You came up with a nursing diagnosis. You have planned on what will you do to make them reach their goals. So now it's all about the action. So in this stage, you are simply doing the interventions that you came up in the planning phase. So as you can see here again in our case scenario, Nurse Pia helps Julia and her family. They were able to explore their individual spiritual beliefs. And finally, the last stage of nursing process is the evaluation. So evaluation focuses on the effectiveness of nursing process by reviewing the expected outcomes to determine if they were met by the time frame indicated. So in this stage, you are always evaluating your patient's progress, where they are in the recovery, and what needs to be changed in the previous steps to help them meet their goals. So this last step is all about reassessing your patients to make sure that they are meeting their goals or they are making progress through their goals. And these are the steps of nursing process, the ADPI, which are the assessment, diagnosis, planning, implementation, and the evaluation.
Many cultures have very different perspective on healthcare. In some culture may have a tradition that prohibited to use a certain medication. But the Leininger three modes of nursing care decisions and action guide nurses' judgment, decision, and action in order to provide appropriate, beneficial, and meaningful care. We have three modes of nursing care, decision, and action. The first one is cultural care and preservation or maintenance. It is help people to retain and preserve their relevant care value so that they can maintain their well-being, recover from illness, or face handicaps or death, which is professional action and decision that assist people of a particular culture in retaining or preserving relevant care values. We should assist patients or clients in retaining or maintaining their culture. We must first define the client's personal and cultural identities in order to be able to assess them in maintaining their culture, because different things, different people's cultures. So, it is skilled action. These are the attachment to their values that go through a specific study to fasten the patient recovery or to maintain their well-being. So, what we will do in terms of cultural care preservation and maintenance? In this case, the beliefs or values of specific individuals or groups, their beliefs or values about health, recovery, or death, we don't remove it. In case, we preserve it. That's what they believe and respect their decision to maintain their values. And the next is cultural care accommodation or negotiation. It is the supporting, facilitative, or enabling specialized action and decision that help people of designated culture to adapt to others for a beneficiary or satisfying health outcome with professional care providers. Cultural care accommodations comes in if we can keep the preservation and maintenance. There will be negotiation here. We will not eliminate the culture or their beliefs. Instead, we will adopt the culture that we learn. This will not take away their culture, but it will assist people of a particular culture in adapting to or negotiating with others in healthcare community in order to achieve shared goals of an optimal health outcome for designating culture's clients. We may also negotiate and handle them without offending their culture. Again, we may adapt, but we will not change their culture or beliefs. So, there's already a negotiation here or accommodation. The patient accepts it's a part of his culture. However, there is an evidence that our theories studied that there is an applicable or most effective way for care for the patient recovery. It is adopted by the patient and it should be culturally appropriate. We are negotiating with the help of our professionals. We are looking into it. We're putting that we learn in our training to use here in this case. We must convince or negotiate with the patient that this is a best course of action or the best way for his recovery. And the third one, culture care repartnering or restructuring. This is a assistive, sustaining, facilitative, or enabling professional action and decision that help clients greatly change lifeways for new. Different beneficial healthcare patterns while regarding the client's cultural values and beliefs, the client's cultural values and beliefs, and still giving a beneficial or healthier lifeways before the changes were laid out with the clients. Cultural care partnering. It is like the nurse set mutual decision with the patient to use changes in their care plan. When the patient's life is in risk, repartnering is necessary. So, in cultural care, repartnering or reconstructing is when you study the culture first, but there will be a changes. There will be a changes because not all cultures are the same. People who live in the province, for example, may refuse to have their medication or checked by a medical professional, especially during this pandemic, because some people can't avoid spreading rumors through social media. So, what will happen to those living in the province? They will not seek the medication attention because they are afraid of the information they have heard and read. So, you can't force people in remote areas to see a doctor. Previously, there was a negotiation, so the culture and proper way of caring were already explained. The patient should understand the changes when repartnering or reconstructing, but the changes should not be too far to remove from the patient's culture. In other words, we are rebuilding it and not remove it. Will not remove it fully. You will speak with the patient and explain that this is a type of care you should be receiving. But again, this should be based on the patient culture. And now, based on our scenario, the patterns formulated from Nurse Pia's research in culture care, preservation, and maintenance is Nurse Pia will arrange visit with a priest who could provide hope and strength. Religion can be used as a strengthening means. Maintenance of strong caring by family, relatives, and the friends of the patient will also contribute to his well-being. Second, the cultural care accommodation and negotiation. And on our scenario, Nurse Pia will try to find a support group of cases and similar to the patient case for further education about his situation. Nurse Pia will investigate her prescribed medicines to determine whether they are compatible with the generic or folk methods that patient uses. And also the last one, the cultural care repartnering. A dietitian will be sent to help the patient with a menu that will both agreeable to him and will contribute to better health. Nurse Pia will also attempt to help the patient stop smoking. Also, other people in the household who smoke will be introduced about health hazard to secondhand smoke around non-smokers.
So, I'm going to discuss acceptance by nursing community. So, practice. So, as a culture, there are so many different arrays. Families are less satisfied with the nursing in medical services. Nurses who travel and seek employment in foreign lands experience immigrant status. Transcultural nursing education has become crucial for our nurses. So, as our world becomes more culturally competent care, some nurses understand culture shock conflict and rushes, as they are moved from one place to another, like from rural and urban communities without transcultural nursing preparation. We go into education. With the sensitive public awareness of cause, there are different culture in human rights. There is a superior demand for comprehensive, holistic, and transcultural people who train to safeguard quality-based care and prevent legal suit related to improper client care. Since 1980, there has been craving a number of nursing curricula emphasizing transcultural nursing as a human care. Of a first program of focused care was a Questra College in California in 1970s, where an undergraduate nursing program was developed with a care as a central curricula them. Last, research inspire many nurses to pursue research and to learn some entirely new knowledge in nursing. So, a lot of nurses today are using Leininger culture theory. Worldwide, the theory is the only one nursing focused purposely in culture care and with a research technique which is ethno-nursing to examine the theory, finance, and sustain transcultural nursing as not enough to transcultural nurse in other nurse interested in transcultural nursing. Research are during the research despite adequate funds.